Can you see my screen?
Yes.
My presentation?
Yes, perfect now. Okay.
Sorry for this small delay. Good afternoon. First of all, I would like to thank to the organizers and particularly to Professor Isabel Sá Correia for giving me the opportunity to talk about the trending organism in a more environmental rather than clinical point of view. So I'm going to be talking about SARS-CoV-2 in wastewaters, and just a small, oops. Just a small background information. By the end of last year, 24 cases of pneumonia of an unknown etiological agent was reported by China. And in January, the disease, later called COVID-19, was known to be caused by a novel coronavirus named severe acute respiratory syndrome coronavirus 2. And by March, a couple of months later, the WHO already declared COVID-19 as a global pandemic. As of today, we have worldwide close to 30 million reported cases, which amounted to almost 1 million deaths worldwide. SARS-CoV-2, as I said, is the etiologic agent of COVID-19. It is a member of the coronaviridae family, and as all viruses, it's very simple structure. It's an enveloped virus with single-stranded positive sense RNA, so a very simple structure. The current testing for SARS-CoV-2 is based on the monitoring of respiratory system samples and saliva by RT-qPCR, which only gives us syndromic surveillance, meaning it needs report from symptomatic persons. What do we do with the asymptomatic population, which is estimated to be between 20 and 45% of the total infectious cases, or with the pre-symptomatic population? This kind of testing does not give us any information about that. It also doesn't give a almost real-time information on the trends on the population. If it's increasing the number of cases, if it's decreasing, it's not almost real-time. So what can we do about this? There has to be a better way. And we have not a better way, but a complementary way, which is called environmental surveillance, which has been used for various reasons throughout the years in tracing contaminated water sources causing outbreaks, in testing particularly, which is what interests us, the pathogen and disease surveillance complementary. And the best known case and the most successful case is the poliovirus and the poliomyelitis. So with the global polio eradication effort, we have two different surveillance indicators. We have the first one, which is the gold standard, which is the acute flaccid paralysis reporting. And complementary to it, we have the environmental surveillance by testing sewage and other environmental samples for the presence of the wild type poliovirus or the vaccine type virus. Monitoring this type of samples allow us to do the monitorization of the vaccine and how it's working. Also to track silent circulation of the virus, because if we don't have any symptoms, we can have the virus circulating either way. We can also better access the eradication of possible existing outbreaks or zones where it's becoming it's circulating again, and also to document the transmission and the importation of new cases. There's a very interesting work on the surveillance of vaccinal poliovirus in Kenya. This was done during 2015 to 2017. And the last case of wild type poliovirus in Kenya was in 2013, the same as the last time they detected it in the environment. And we can see that by having the vaccine, the trivalent vaccine, we can see that we had a lot of positive detections here in orange for the type 2 circulating vaccine-derived poliovirus. It emerged after the eradication of the wild-type virus. And in 2016, at a given time, they decided to change, given the emergence, they decided to change the trivalent, removing the wild type, the vaccine type 2 poliovirus, and just giving the people the bivalent vaccine. And we can see that from then on, we don't have a lot of, here in the 16th month, we don't have, from then forward, we don't have a lot of positive detections of type 2 vaccine poliovirus, which means that the virus stopped circulating within the population. So it's a very successful way of using water in complement, wastewater in this case, in complement to the clinical surveillance. How about SARS-CoV-2? How can we use it? So, for instance, the name changed. It's not environmental surveillance, it's wastewater-based epidemiology. And these methods have never, ever been applied to assess and predict the disease in the population in a systematic way. What do we know that makes us think that it can be good to use it? To start with, we know that patients infected with SARS-CoV-2 have virus excreted in their feces, and they are in approximately 50% of the samples, regardless of gastrointestinal illnesses or the severity of the disease. Even asymptomatic people can have viruses shed in their stools. One study has detected and was able to culture SARS-CoV-2 virus from the stools, whereas another one failed to do it. So we still don't know if there's SARS-CoV-2 infectious virus particles in the stools and in the wastewater, of course. Another important aspect is that when we have a place where we don't have any cases and we start looking at the wastewater and we find SARS-CoV-2 RNA in the wastewater, then it means that we have either asymptomatic people or even pre-symptomatic, which means people that have the virus will develop symptoms but still don't have it. What can we see in the wastewater looking at SARS-CoV-2? We can see trends, which is really important to see if the numbers are increasing in the wastewater, implying that the numbers are increasing also in the population. We can see the decrease of the curve when we have the phase out of the epidemiologic curve. We can track the disease prevalence in the community and try and identify hotspots of infection. And so far, we don't know much about the risk to the wastewater treatment plant workers because it's not easy to isolate this virus from wastewater. And from what we know now, so far, there are no the virus in what we detect in the wastewater is mainly RNA rather than infectious virus. We don't think that there are a lot of infectious viral particles in the wastewater. So what are the implications of looking at SARS-CoV-2 in wastewater? Well, we have an early warning system because we know that viruses are shed, or RNA is shed in the feces of infected people 4 to 7 days before the development of the first symptoms, if we have the symptoms. So, and it was proven that there is a correlation between the patient reports and positive results in sewage of about 4 to 1 week, which means that we have at least 4 days to anticipate and prepare for, in this case, a new wave of virus, a viral infection, or in the case of possible future outbreaks, we can look at the wastewater and have in advance an idea that we have the virus circulating in the population. For instance, it is known, and it was on the news, that in Barcelona, the virus was detected in wastewater samples from March 2019, so really early. And this could give us an heads up so that we can put in place all of the instruments we have to combat these outbreaks and these pandemics. As a result, several groups throughout the world have been working and applying a wastewater-based epidemiology for SARS-CoV-2, and the first report was in the Netherlands. As you can see in this figure, there are a lot of blue balloons throughout the world, which shows you that which means that these groups are working in the detection of SARS-CoV-2 in wastewater, and it's been a really enriching experience because people are sharing their results, sharing their problems, sharing their work, sharing their materials. It's been really rewarding to work in these difficult times doing this kind of work because people have gone far and beyond. I'm going to present you two cases where there are a lot more, as I showed you, where SARS-CoV-2 wastewater-based epidemiology was used. And as you can see, this one is in the Netherlands. And you can see in orange the graphic with the concentration of SARS-CoV-2 per milliliter in wastewater. And you can see that it follows really well the epidemiological curve of prevalence in the Netherlands, where we have an increase in the number of cases. We have an increase in the concentration of SARS-CoV-2 RNA in the wastewater, where we have a decrease. It follows simultaneously the decrease on the concentration of virus in the wastewater. And we can even see here in July at the end of the graph that we have an increase in the number of cases of the prevalence of SARS in the population. And immediately we see also an increase in the concentration of SARS-CoV-2 in the wastewater. Another good example is in the US, which was vastly affected by this pandemic. Here, this one is in Virginia. And the graphic on the left, you can see here where we have at the beginning until June, we have the lockdown. So the number of infected people is really steady and low. So are the numbers of the viral loading in wastewater. But then when we have the opening of the state, we can see a deep increase in the number of cases in the population, followed with a huge correlation by the concentration of virus in the sewage. And here on the right, you can see it's another graphic with different wastewater treatment plants in the state. And we can see that from June forward, there's basically an increase in all of them, which was reported to small hotspots of infection in the service areas of these wastewater treatment plants. So it really mimics with days ahead the impact that we see of the pandemic in the population. In Portugal, we also have a project ongoing that we're a part of, which is called COVID Detect. And basically it looks into the wastewater for the detection, quantification, and modeling of SARS-CoV-2 in wastewater as a watchdog for the dissemination of the virus in the community. So what we have been analyzing wastewater from 5 different wastewater treatment plants in Portugal on a daily basis, covering around 20% of the Portuguese population, and also daily analysis of 3 COVID-19 hospital wastewaters since April. Unfortunately, I cannot show any results because this data isn't published yet. So, but you can see from the previous examples I gave you that it works quite well and in advance to the increase or decrease of the levels of infection in the population. So what from these few months, it's been 5-6 months since the beginning of the environmental surveillance or wastewater-based epidemiology of SARS-CoV-2, what have we learned from it? We know that testing wastewater, we test thousands or millions of people, of infected persons at the same time, rather than just one person. And we test not only symptomatic, but asymptomatic, pre-symptomatic, and post-symptomatic population. We can see trends in the virus spread over time and even go to small hotspots of infection. Wastewater-based epidemiology should be complementary to the health surveillance because it gives us a heads up of what's coming. And since it is a scalable, it's cost effective, and it is a rapid way of doing analysis of a large population, it can be really useful in countries with limited resources in helping them with policy making, particularly in the case of pathogens such as the polio that worked really, really well, and also for antimicrobial resistance. So that was it. Thank you.
Thank you, Sílvia. Thank you for your presentation, very interesting.